Okay, ladies and gentlemen, welcome, and we'd like to call to order the meeting of the Rutherford County Risk Management Committee. And those of you that have read your minutes, we need a motion of approval.
Motion to approve.
Ms. Hickerson, in a second. All right, Mr. Hafner. Anyone have any corrections or additions? All right, all of you in favor of that, then please say aye. Aye. Any opposed? Thank you. All right, Mrs. Street, financials, please.
Yes, sir. Welcome to the last meeting of 2017. Should be a pretty easy meeting today. February, maybe as much, and then we'll start rate discussions, so don't get too spoiled. All right, for the month of October, we ended with revenue of $6.2 million and expenses of $5.6, with a difference for the month of $627,924. When we look at the calendar period year-to-date of revenue versus expenses, prior period revenue was $50.3 million compared to current year of $54.2 million, with expenses of prior period being $56.5 million, with current being $54.1. From a fiscal year perspective, year-to-date, revenue for prior period was $14.5 million compared to current of $15.3, with expenses coming in prior period of $23.7 compared to current year of $21 million. If you go to the second section of the last page, we'll look at 2017 calendar year revenue versus expense comparison. And currently we are in the positive at $165,467. If you go on down to the last column highlighted in yellow on this page, you'll see a fiscal year comparison, and we have come in at $5.6 million short currently.
Okay, questions for Mrs. Street? Oh, she's going to continue with Fund 266 before questions. Okay.
So Fund 266 ending in the month of October, we came in at $400,106 compared to prior year of $155,137.
All right, now questions. What's your assessment of, what's your conclusions in these numbers you just told us about, Ms. Street?
Well, I look at the world a little different than finance, so I review it from a calendar year, and my main focus is to make sure that we are collecting enough revenue to offset expenses, and it shows that we are trending well in that regard. So currently I have no concerns. We also, with the help of Willis, revisited what our rates are currently set at, and we have looked at projections, and we look to be running positive in that regard as well. So I have no concerns about, how our revenue versus expenses will end in the current year or next.
So you're telling us that you think we're going to have more revenue than expenses when we finish this whole 12-month period?
I'm saying that we will at least break even. If we end
okay.
in the positive, that's great, but in a good year, we break even.
Okay, good. Well, that's still good news. Other questions or comments? All right, do we approve your financial report or just accept it? Okay, so we don't need a motion on that then. All right. Next, we have workers' comp and OJI statistics. Mr. Good, you can give us a report on that.
Good afternoon. In the month of October, we had a total of 22 injuries requiring medical attention. That brings the total for the year-to-date from January 1st to the present to 182. Of that 182, 109 of them were OSHA recordables, 45 had restricted days, 25 lost time days, and 39 all others. On the next page, you'll notice how we compare this year to the two previous years as far as the claim count, and we are up slightly this year. On the third page of your report, you'll notice that we are up on our incurred dollars. I can tell you that's basically because of one claim. and that one claim is over $200,000, and that's why. But if you take out that one claim, then you'll notice it's right in with all the other injuries, or previous years, I mean. The 22 injuries this month, or the month of October, had total incurred dollars of $54,924. 18 of them were with the Board of Education, and the total dollars there were $19,094. The other 4 were with the County General, and the County General had $35,830. In the last page of your report, we break down where those are in the County General on the last page of your report.
Okay, questions for Mr. Good? So what's your conclusions here, Mr. Good? Are we just holding our own or better than?
Well, I'm optimistic. Safety is a thing of awareness, and I'll always say, you know, we need to be talking safety every day when you go out there presenting it, and when you see something that's going on, you need to take a moment, stop somebody, and at least make them aware of what they're doing, because a lot of times people are not aware of what's happening, you know, around them. So we just need to open our eyes, and I think we'll be doing a lot better.
Okay.
Mr. Good did just recently complete all the re-inspections of the schools, as well as county offices. You've done those as well, is that correct? And we can issue the master report from that shortly, which will give us an idea of not only, you know, it's a two-pronged approach. One is the day-to-day safety measures that we take, but also when we do identify something, how quickly do we rectify those issues and mitigate the risk? And so that's what we'll be able to see based on his report that is forthcoming to us.
Okay. Mr. Nipper.
On the Board of Education, motor vehicle, was that a bus accident?
It was a bus accident on one of the special ed buses, and the injured person was an aide on the bus. So.
Any other questions for Mr. Good? All right then, thank you very much.
Thank you.
Mr. Puckett, wellness update.
Good afternoon. We concluded our Know Your Numbers campaign for 2017 back in September. You can see here, out of the possible 4,801, that's either individuals on a plan by themselves or they had a spouse on their plan. Those are the people who were required to complete it for the year 2017. We had 4,121 complete that. That equates out to 86% completion rate for the population. This year we're sending out 680. Well, I guess I shouldn't say fees, but 680 of those 4,800 will not receive the premium reduction. 4,121 will receive that premium reduction. You can see from 2016 compared to this year, it's a little bit higher than this year at 89%, and we had 568 sent for the fee last year. And it's not for lack of effort. It's a little disheartening for me because I feel like the wellness team has made a conscious effort this year to go out and promote the wellness initiatives. We've even provided incentives, like I mentioned a couple months back. We did iPads, but we still are still trying to get that number above 90. I will say, though, even though we are a little bit lower than last year, the industry standard is still hovering around about 50%, so I think we're doing well above the national average. We're going to keep plugging away at it. In mine and Chuck's experience firsthand, I haven't spoken with all the 680 people, but the people that I have talked to have basically said that they would rather pay the $300 premium reduction than go through the biometric screening and online health assessment. So that, to me, is kind of a head scratcher, but some people just quite frankly are not. They'd rather just take the fee than have to go through all that stuff. So hopefully, as we move into 2018 with our health promotion efforts, we can kind of change their mind about doing stuff like that. So that right now is it for the Know Your Numbers. Monthly coaching for October, the wellness coordinator had 10 initial visits with 26 follow-ups for a total of 36. The dietitian saw 8 initial visits with 15 follow-ups for a total of 23. They currently have 59 active patients with 59 total visits in the month of October. We did have our employee wellness fair last month. Thank you for all those who participated. We did see a little bit more participation on the tally counter than we did last year. It was maybe like 8 to 10, so it wasn't too much, but we did see an increase there. We had 25 mammograms, and that's actually the cutoff for that. So that's the reason there's not more than that, because St. Thomas will only do 25. Did 287 flu shots. We had 82 people complete a wellness survey where we asked for their feedback on the wellness program, what they would like to see moving forward. 63 vision screenings. We had 52 people do the body mass index. The diabetes screening, which I thought was good, 85 there. We also, Anytime Fitness did a fitness assessment. 57 people did that. 91 people did blood pressure. We had angio screens, which is one of our most popular. We paid for 24 of those, and they gave us one as a incentive. So hopefully there's a big need in the county for that, and there's a lot of interest. So we may increase that number next year depending on our budget. 69 people did the drug and alcohol screening, and then the bone density screening you can see there were 65 participants. Current and upcoming events, right now we're going through our Touchdown True Wellness program. It seems to be going well. We have 115 people participating in that in teams of 5. Each person on the winning team will get a $125 Amazon gift card. And the program is really around health and wellness and building teamwork and a lot of fun activities. There's a scavenger hunt and things like that involved. So we'll try to share some pictures with you guys next month. There's some pretty interesting stuff out there. They're having a lot of fun with it.
So before you move on, this was the first year without the guidance of Ms. Perrin with the wellness fair. We handed the baton over to the Cigna team, and they did a very good job putting the program together. We had a lot of positive feedback. I want to thank them for their work and effort that they put forward. It was very well organized and executed, and we appreciated that very much.
Thank you for
Question
that.
before you move to the next page.
Yes, sir.
Tell me what this drug and alcohol screening, what prompted people to want to take that
So we
screening?
We did a bingo card. Every year we do a bingo card, and it has certain activities. Most of them you see listed here. So if they do the drug and alcohol screening along with other things, they get 5 activities done on the bingo card. They then put their bingo card in a drawing, and we draw for that. And Mr. Mayor, if you recall, that's what we had you draw for last month for some
Had
of
to
those
have the
prizes.
screening to be in the bingo card drawing?
They didn't actually have to have that one. 69 people just chose to do that as one of their activities.
Okay.
It was offered through our EAP program.
Correct.
They were there as a vendor, and that was their table activity. It's a survey that you take. It's a screening process, and so as they went by the EAP booth, then that was an option for them.
Okay.
Again,
Ms. Hickerson has a question.
yes, ma'am.
Before you move on, of all of the screenings that you did at the wellness fair, were you able to catch some folks that didn't realize on the sugar or the blood pressure or do you know that yet from these activities?
That's a great question. I do not have the individual numbers for those people who did stuff like that. I have to reach out to the vendor who was doing that stuff, but that's something that I could definitely look into and share at the next meeting.
Well, it would,
Absolutely.
Not specifically that, but yes, we caught some folks that didn't have blood.
Absolutely. And then there's also, the ladies from the angio screen sent me some information as well about what they saw, and I will bring that to our attention next month as well.
So I think one of the things that's important to note, earlier this week, myself and several Cigna reps, our clinic partner, we all met to go over our annual reporting, and diabetes does remain one of our top conditions, and I'll ask Mr. Huffman to provide an overview of that report in our January meeting. So the fact that we picked up 85 individuals who just went through the screening is important, just for the sheer fact that it remains one of the top conditions that we see in our claims experience that's passed over to Cigna. So, we're grateful for the participants that stopped and took that time to do it.
And because there is such a need for that, based on the CAP report and the people who participated, also hypertension is a big one. So we're going to work with the dietitian over at Premise to work on some presentations for next year, like eating with hypertension, eating with diabetes, and things like that to kind of help people, educate people and stuff like that. So the next page, if there's no other questions on that.
I think you have a question.
Oh, I'm sorry.
sorry.
So the portability for the reports and also identifying if any of these folks that took the screenings that had some risk factors, let's say, did you find out if they have an internal medicine doctor or general practitioner they see that, and is this information electronically given to them, or are they given a report to take to their doctor?
It was.
Why don't you explain how the health fair, the vendors are selected and kind of how the health fair is executed, and that may help explain why the data is not fed back to us.
So what we have is we have all of our vendors, obviously Cigna's there, Towers Watson, Primus, everything like that. We do flu shots. And then we have vendors from around the county who will do certain things like, Elements did massages. We had diabetes screenings. St. Thomas did. So we have them all set up at an individual table. So imagine it being like a vendor fair, like a benefits fair where you go around from table to table. And we want to, because it's a wellness fair, we want to try to make it interactive. So we set up the bingo card, and we reach out to these vendors, and we confirm with certain vendors, say, hey, we would like you to do interactive activity at their table. So that's what you see here as far as these activities. As far as going, getting that granular of a level, we don't do that. We don't actually see that stuff. We're just coordinating all that. We want them to go do it, and then our hope is that for most of these, if there is an issue that's identified there, they communicate with that, and then these vendors are talking to them about these certain procedures. Because there's only a few of us, and 450, 500 people come through, it's kind of hard to monitor that stuff. But moving forward, I think that's something that we could do for next year's fair, is to kind of have something along those lines that they have to report back to us, and then we could report it to you guys.
Also, in addition, all of the tests and various things that they went through, they're generic enough to identify you may be in a risk category or have a risk. If you were identified in that area, the vendor themselves would direct you to, do you have a primary care provider? You should go to this. It's not going to identify immediately a large-scale test like an A1C test, but it would let you know you're in that range. You may want to check with your primary provider, things like that.
Any other questions on this page? All right, so what we're going to start doing, and I'm kind of excited about this one in particular, is we're going to start each month promoting a Cigna product or service that is offered to Rutherford County's employees, kind of highlight it, give an overview of it, and you can take it back to your employees as well, and then also use it yourself. So we're going to try to focus on one of those each month. This first one is Active and Fit Direct. This is a really cool benefit you guys have that is available to you. Think of it as it's basically what it is. It's a network of gyms. So a lot of gyms, if you log onto this site, and I've also included a Q&A that will go over everything in greater detail if you guys have any questions about it. But just kind of an overall sense of what it is let's say if you're a stickler about a gym, or if you're picky about a gym and you like machines at this gym, but you like this gym because it's close. So if they're both in this network, you can pay $25 a month and you can use any gym within that network. So you don't have to have a gym membership at Planet Fitness and pay $10 a month. You don't have to go to Anytime Fitness and pay $40 a month. You can pay $25 a month, and both of those gyms in Murfreesboro are in network. So you take your Active and Fit card, whichever day you feel like going to Planet Fitness, boom, scan it, you're in, you can go to that gym, and then the next day you can go to Anytime Fitness. There's over 9,000 gyms in this network as of now. I don't know how much of you guys travel, but if you do travel, let's say if you go to town for the holidays and you want to get a gym session in to work off the turkey or make room for the turkey or whatever the case may be, you can have a gym right there that's in that network. And if you log on to the site, you can search by the zip code all the gyms in that network. And a lot of gyms will indicate also if there's a guest pass. So let's say if you're not certain you're comfortable with that gym or not, you can go there and they'll offer you a guest pass and you can try it out first. It's a really cool benefit. I will say, it says $25 a month plus an annual enrollment, plus a $25 enrollment fee. It's actually going to be $75. It's kind of tricky. So what you'll do is, let's say if you go in today, what is today, the 16th? You walk in today, you'll pay the $25 annual enrollment fee. You'll pay $25 for this month, and then the next month, and then the third month it'll start reoccurring just $25. But you get an abundance of gyms within Rutherford County, Smyrna, Laverne, things like that. So you guys can look at that, browse. It also has trackers where you can go in and track your exercise, all of that fun stuff. It's a great resource for the employees of Rutherford County. I know you can say, well, $10 Planet Fitness, this and that. I get that. I totally understand that. However, you get the ability to go to different gyms, wherever you may be located. So it's kind of a nice resource to have.
So just to clarify, I'm sorry, Ms. Stevenson, just to clarify, they can go to any of the 8,000-plus gyms,
Correct.
and there are a lot of gyms located within Rutherford County.
Correct. So
Okay.
there's the Anytime all the Anytime Fitnesses here local. They just built one over here next to Burger Republic. I can't think of the name of that nice new building. Yes, and then the Anytime Fitness out here on New Salem, all the Planet Fitnesses in Rutherford County as well. And then you can search, if you live outside of Rutherford County, you can search your zip code, and then there's gyms available, closer to where you live.
So my follow-up question is if I heard you right, you were saying you could join this, and if you go to Planet Fitness one day, but you wanted to go to the MAC the next day, you could, and that's not a problem.
Not at all. It's
Then why would
$25.
you need a guest pass
So
to
it's
try out a?
They offer you a guest pass just in, like, let's say if you've never been to a gym before, or if you want to kind of get a feel for certain ones, then you can go, and they offer that as just kind of an additional service.
So if you look at Planet Fitness as a standalone for an individual, it's $10 a month, right? And the initial reaction may be, well, I can pay $10 a month and just go to Planet Fitness, right? But on the weekends, what's closer to your house is Anytime Fitness, and you never drive to Planet Fitness on the weekends because it's too far of a drive. Before you cancel that Planet Fitness and join this program, you could get a guest pass, go try Anytime, see if you would even like that and use it on the weekends, and then elect to join this program. So that's the benefit of it.
That makes sense. The next question is after that third month, is it a bank draft? Is that how it's set up, or do you submit payment?
So what you'll do is it'll be just like a draft at any gym. So it'll take it out on like the first day of the month or the middle of the month. I'm not sure quite how that I think that might be in the Q&A.
Correctly, it's either bank draft or credit draft.
Correct.
Okay. And then
But
my,
it'll be the same day every month.
okay. And then my last question is, if I understood, looks like Q&A number 11, it says about participating. If you choose another option, you can offset if you want to upgrade the plan. Is that where the family plans come in? Because I'm taking that this is $25 per individual, and so if you wanted to upgrade to a family plan, you would just pay the additional, is that right?
Correct. So like, for example, at Planet Fitness, they have a $10 where you can just go to that gym, and you don't get to use the fancy stuff like the massage chairs and the tanning beds and all that. Now, you can get the VIP and pay an extra $10 a month, or that allows you to go to any Planet Fitness in the country, and then you get access to the massage chairs and things like that. So that would be kind of similar to what you're talking to.
Also, and to clarify, for this particular membership too,
Mr. Chapman, can you move to the microphone?
standard rate at any fitness center within this network. So Planet Fitness, for example, has that platinum where you get the tanning and all the other stuff added to it. This will be the standard membership. So just what you would go in there, no additional features to it when you're in this network. Now, if you wanted to upgrade and say you did go to the Planet Fitness and wanted to upgrade to that platinum thing, you have the ability to do so, but it'll be at an additional cost with that particular fitness center. Yes.
But again, this is a great tool to have, and if you are a stickler about gyms, I don't know if you are or not, but it's a great option to have, especially for $25 a month. So any other questions about this program that we have? And we'd ask that, you send this stuff out to your employees and make them aware of it, and we'll do the same. We'll communicate this stuff out. This was actually in the newsletter we sent out at the beginning of the month for everyone that read it, which I'm sure was everybody, so hopefully people are already taking advantage of it. But any other questions on that before I get to the last thing? All right, one last thing on the back page there. Every year in our efforts to try to raise awareness about what we do, we send out a magnet. We send out a magnet that highlights some of the key things that we do throughout the year. Just highlighting, like talk about the wellness fair, the biometrics and online health assessment reminder, the lifestyle management classes that we'll have throughout the year, and obviously we'll communicate these out as they approach. But just want to have everybody kind of understanding what we have going on throughout the year for 2018. That's kind of a basic overview of it. Those magnets will be going out a week from tomorrow, which is December 1st. And hitting mailboxes that following week. So once you get it, if you see an envelope from Risk Management, please don't throw it away. Please open it because there's important information in there. I'm sure you always do that, but just slap that on the fridge or put it in the break room at work so we can spread the word about what we're trying to do here. But we really appreciate your support and all what we're trying to do in our efforts, and 2018 is going to be a good one. Any other questions? Thanks, guys. Happy
Okay.
holidays.
Thank you very much. Open enrollment results, Mrs. Street.
I provided 2 documents for you. I just wanted to give you an overview of how open enrollment went for 2018 benefits. The first is a benefit plan year comparison from a statistical perspective. Since we went from an active enrollment to a passive enrollment, I assumed that people would want to know what that looked like. So you can see that for the current year, we had the 6,213 eligible employees to participate in open enrollment. Of the ones that could participate, 3,202 actually accessed the benefit system. The percentage that did not access was 48%, and 2,348, or 37.8% of those who are currently enrolled in benefits did not go in and access the enrollment system during the annual enrollment period. So we did accomplish the goal of no one lost benefits. I can tell you, looking at these numbers makes me pause. And I assume that I'll be getting phone calls in January, as will payroll, when some of these deductions come out, particularly those that are in the deductible plan that may not have looked at the premium increases. So I guess stay tuned or learn more, right? So if you go to the second page, on a positive note, if you'll look at the last column, you'll see that we did have a decline of 16.32% participation in the deductible plan. So some people looked at the rate increases and made consumer-driven choices for themselves. We also had an increase of 11.17% on the HRA plan. That puts us over 50% participation in the HRA plan and our most participated plan for our employee population. The copay plan shifted 15.06% increase in participation. I know individually I counseled with a lot of employees to help them make the right selection for themselves and their family and their insurance benefits. I am seeing a change in the employees in terms of wanting to better understand the various plans that are offered and to be more active in the selection process. So the fact that we're seeing these shifts is positive. It means that people are paying attention and becoming more consumer driven, which is what we want. That is a behavioral change in the right direction, because that will also trickle into wellness and other areas that help to improve overall well-being, as well as financial health and other areas that we are concerned about in the risk management department for our employees. So I just wanted to share this information with you all. Are there any questions in regards to the open enrollment information we provided?
Okay, any other questions? Let's ask does anybody have any feedback from your departments or from your offices, school board? What kind of feedback have you gotten this year from your participants?
They really like a passive ability to do that, and they chose to go online a lot. So that's a positive feedback. Calls have been very different this year as in years past.
Okay, so we won't know if people are really upset till they get the first deductions out of their
Right.
checks, I suppose. All right. Then, next is Life Services EAP bid. Ms. Street, what's that about?
This is just to advise the committee that our contract and our current EAP arrangement will end in May of next year. So we will be going to bid for our EAP program at the beginning of the year. And once we've completed the review of those bids, when they come in, you'll see it on the agenda, and we'll present those results to you.
Okay, so you're going to issue those RFPs when?
We'll probably release it in January, February period. Depends on when I can get on the various committees' schedule.
Anyone have any other business they want to discuss?
I have one thing. I'd like to make the committee aware that Evelyn Anderson, who has served 20-plus years in the Risk Management Department, will be retiring on December the 20th. We're very grateful for her service to the county general employees. I know she's held in very high regard by the ones that she has helped. And we have been putting succession plans in place for the department for the last 2 years in terms of cross-training and things of that nature. So when she gave us her intent to retire, we were in a good position in terms of training and such. We will not issue a posting on that position until after the holidays to ensure we get the best candidate pool for that position. In the interim, we will absorb her work the remainder of the month of December until we hire someone in within the department utilizing our current benefit administrator. So we want to thank Ms. Anderson. She served many years on this committee as well, and she's done a lot for our department. We're grateful for that.
Okay, thank you very much for that. All right, I don't see anybody else wishing to bring anything forward. If that's the case, then we are adjourned. Thank you very much.